Hello everyone, and welcome to week number 3. Our focus this week will be on vital signs, communication, and the office environment. With that being said, we have 3 chapters that we're focusing on this week: Chapter 5, Chapter 6, and Chapter 35. Now for this week, I'm only going to discuss Chapter 5 and 35 for the video. Chapter 6 is going over and talking about the office environment, again revisiting OSHA and the CDC and the standard precautions, universal precautions, and also looking at how to handle exposure control plans, which should be something that you guys talked about last week in your lab class. So I'm going to skip discussion on that chapter, but it's still very important that you read up on that on your own time. So let's go ahead and start with talking about Chapter 5. So Chapter 5 starts our discussion on communication. So communication really is a necessary requirement for everyday life. There's not one day that goes by that we do not communicate with others. Now, in the medical field, having the ability to communicate is essential for success in the field. Everything from calling in a prescription to be refilled to documenting a patient's complaint and their reason for visit. The concern that we have for our patients will show in our words, our actions, and our gestures and tone of voice. So all of those things need to be something that you pay attention to. We have to be able to communicate with a wide variety of people in the field, especially people like patients, physicians, vendors, other coworkers, and families of the patients. All of those are individuals we have to communicate with. But there are different channels and forms of communication that we use. For example, they could be face-to-face discussions, discussions over the phone, communication in letters or written words, a fax, or an email. But it doesn't just end there with good communication skills. We need to have good interpersonal skills as well. With interpersonal skills, that includes your self-awareness, so making sure that your character, your values, and your attitude are all in the right places. Making sure that you're able to understand the different learning styles, so people who are auditory or like to do things by hearing, visual people who like to learn by seeing, and kinesthetics who like to learn by touching, or doing, or acting. So now that we have discussed the communication, we need to know that there are 2 different types. The first one is verbal. So verbal is the spoken words, sounds, and tones of voice that we use. When you, as the medical assistant, are speaking to a patient, you want to speak loud enough that they can hear you, but not so loudly that you are breaching confidentiality or even that you're yelling at them. You need to be cautious of the words that you use. So you want to choose your words carefully and try very hard not to come across as rude or disgruntled. Don't use any technological terms or medical jargon, as patients may not understand them and it will confuse them more. And take into consideration their education level. If the patient only reads or speaks at a 3rd grade level, you can't talk to them like they've received their doctorate in college. You need to have a positive attitude as well. Being empathetic versus sympathetic is extremely important. You can understand what the patient's experiencing, but you don't want to experience it with them. Opposite side of the coin is talking about nonverbal communication. So this involves all your facial expressions, gestures, body language, eye contact, grooming and mannerisms, all when you're talking to people. It's important to know that nonverbal and verbal communication match. So they have to be in the same wavelength. Otherwise, you're going to send mixed messages to your patients and to other coworkers. Now, the last thing I want to talk about and have you guys be aware of is some of the barriers to communication. So this can be anything that kind of breaks the line of communication from being a smooth, clear line and making that communication easy. Some things to watch out for would be defensive behavior or angry patients. If you've got an angry patient, they aren't listening at that time when you need them to. And maybe vice versa, they're not communicating with you what their needs are. Again, avoid using medical jargon or medical terminology, because sometimes that does tend to confuse our patients, and that's not the goal when we communicate with them. Having some cultural issues, maybe it's a different language or a different viewpoint. Maybe they have a different religious preference and it doesn't agree with what you think. Maybe it's that as humans, we created stereotypes and biases, and we've set prejudices that cause us to break that communication barrier. So all of those things are something to be very cautious of moving forward into the field and learning how to break down that barrier. All right, so that's all I have for Chapter 5. I'm going to switch over to Chapter 35 now, which is all about vital signs. So I know some of you have been itching to start this, so hopefully in your lab classes you get some time to do that. But vital signs are really the full responsibility of the medical assistant. They're essentially a quick snapshot for the provider to know how that patient's body is functioning. Now, as medical assistants, you're responsible for 6 different vital signs at every visit. Those 6 are height, weight, temperature, pulse, respirations, and blood pressure. So let's go ahead and take a look at each one of those and break them down so that way you have a better understanding. Now, typically, at the start of every visit, you're going to start by taking a patient's height and weight. Typically, you want to do them first thing when they come in. They don't have to be resting to take these, so getting them when they're already standing up makes this a little bit easier. But weight is one of the vital signs that you first take, and it should be done in a private area to make sure the patient feels more at ease and more comfortable with having it done. You always want to have the patient remove their shoes or any heavy outerwear, especially during wintertime when they're wearing like the heavy jackets, the hoodies, the scarves, the hats. Have them remove all of that before they actually step up onto the scale. If the patient, however, does refuse to remove their shoes, because some of them don't like to have that done, just go ahead and document that you took that with their shoes on. And you always want to make sure that you document the weight in pounds. Opposite of that is taking a patient's height or seeing how tall they are. So in order to get a true height, again, you really want to have the patient's shoes off, but if they refuse to, again, document that you took their height with their shoes on. So if your patient is in the room, what we do is we have them stand with their heels, buttocks, and back of their head touching the measuring stick on the wall, or if it's on your scale as you see here in the picture, you can have them back up to that. And then you'll place that L-shaped bar on top of their head, but not their hair. So for women, if we like to wear our hair on top of our heads, you may have to take it out just so we can get that correct height there. And when you're recording height, it should always be done in inches, not feet in inches. So instead of 5'2", it would be 62 inches. Temperature is the next vital sign, and a normal body temperature is 98.6 degrees Fahrenheit. Generally, you always record the temperature in Fahrenheit, and there are 5 sites that we use for taking a temperature. There's orally or in the mouth, rectally, which I think makes sense. Auxiliary is what we consider under the arm or in the armpit. Aoral or tympanic is in the ear using the tympanic membrane. And the temporal is across the forehead using the temporal lobes. Now, body temperature is usually at its lowest first thing in the morning and rises throughout the day. There are some factors that can affect a patient's body temperature, such as the time of the day, age or their gender, physical exercise and emotions, and then other things like medication, pregnancy, or infection. Next, we have pulse, and typically pulse and respirations are taken together. Pulse is the number of times that a heart beats per minute. The pulse is a wave of blood that comes through your body when the left ventricle contracts and then relaxes. Now, your average blood or pulse rate is anywhere from 60 to 80 beats per minute. And typically, if you notice when you're taking a pulse that the patient's pulse is irregular, you want to take it for a full 60 seconds. The most common site for taking a pulse is going to be the radial artery, as you see here in the picture, that's on the thumb side of your patient's wrist. Respirations, on the other hand, is the act of breathing, and this is the process of one inhalation and exhalation. So one breath in and one breath out is actually one breath, not two. Respiration rates indicate how well oxygen is being provided to the tissues of your body. Respiration should be taken at the same time as the pulse rate so the patient does not alter their normal breathing pattern. The average adult respiration rate is anywhere from 12 to 20 breaths per minute. And the last vital sign is going to be your blood pressure. Now, this is the most important vital sign that medical assistants will take. It really helps to aid in the diagnosis and treatment of a patient. Blood pressures typically do consist of two readings: a systolic pressure, which is the first beat that is heard and typically the highest point of pressure, a diastolic pressure, which is the last beat that is heard, or the lowest point of pressure when the ventricles relax. And blood pressure is always recorded as a fraction, for example, 120/80. But as you can see here in the chart, this gives you kind of a nice kind of breakdown of what we consider low blood pressure, normal, maybe pre-hypertension, hypertension stage 1 and 2, and then maybe severe hypertension. And there are two key pieces of equipment that you really need to help you obtain a blood pressure. First would be your stethoscope. Obviously, you need that to be able to hear the patient's heartbeats. And a sphygmomanometer, or a blood pressure cuff. Now again, the average blood pressure for a patient, an adult patient, is 120/80, but just like any other vital sign, many things can affect your blood pressure. Things such as emotions, age, exercise, if they're obese, if they have any known diseases, especially heart diseases, if the patient's in shock or having dehydration, and also if the patient's having any anxiety. Alright guys, so that is all I have. Hopefully you do read over your chapters on your own, as they will help you greatly this week, especially with your quizzes and your assignments. But for this week, you do have one discussion post this week, and it's about communication. Please remember that your initial discussion post will be due on Tuesday, January 17th by midnight, and you need to reply to at least one classmate no later than Saturday, January 21st by midnight. Also this week, you will have a course project homework. What you'll need to do is do a VIS summary for the HPV vaccine, or the human papillomavirus, but you'll also have to do a case study for that disease as well. This will be due Sunday, January 22nd by midnight. You have one written assignment this week, which is talking about the scope of practice. There is a worksheet that you will need to download, complete, and then submit to the Dropbox. And this will be due no later than Sunday, January 22nd by midnight. And lastly, you do have one quiz this week again. It should be 25 multiple choice questions, and it will be mostly about vital signs. There are some communication pieces in there as well. Again, that will be due no later than Sunday, January 22nd by midnight. If you guys have any questions or concerns, please reach out to me. Otherwise, have a happy and safe week 3. Bye, guys.